Welcome. Thank you for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Today's program is part of our Climate Change and Health series, a special collaboration between the Blum Center, the MGH Center for the Environment and Health, and the MGH Institute of Health Professions Center for Climate Change, Climate Justice, and Health. Before we get started, I just want to go a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you're in listen-only mode. Everyone has been muted so you can hear our guest speakers today. If you have any questions for our guest speakers, you may use the chat feature, which is located at the bottom of your screen. We'll have time for in the end. Only Blum Center staff and our guest speakers will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. Okay, so next I am going to introduce you all to today's guest speakers. Joining us today, we have Drs. Patrice Nicholas and Sarah McKinnon. Dr. Nicholas is a distinguished teaching professor and director of the MGH Institute of Health Professions Center for Climate Change, Climate Justice, and Health. She is also the co-director for policy and advocacy of the MGH Center for the Environment and Health. She teaches in the Doctor of Nursing Practice program and advises accelerated Bachelor of Science in Nursing students at the MGH Institute. She also serves at the MGH Center for the Environment and Health on behalf of the Department of Nursing and Patient Care Services. Dr. McKinnon is an occupational therapist. She is also an associate professor in the Department of Occupational Therapy, as well as the founding program director for the Post-Professional Doctor of Occupational Therapy program at the MGH Institute. As a member of the Mass General program since 2011, Dr. McKinnon continues to be involved in clinical practice and scholarship at MGB. They join us today to give a talk on climate change and considerations for populations with disabilities. So please join me in welcoming them.
Thank you very much, Amy, for that lovely introduction. I'm delighted to join you today, along with Dr. McKinnon, a dear colleague who's been involved in climate change and health work in her specialty of occupational therapy. Next slide. So today's objectives are first to identify the specific health challenges that individuals with physical, cognitive, or psychological limitations face due to climate change, including increased risks of heat-related illnesses, exacerbation of pre-existing conditions, and mental health impacts. And it's important to note that in emergency situations, for example, post-Hurricane Maria in Puerto Rico, that those who had pre-existing conditions, comorbid conditions, were at significantly greater risk. The second is to explore strategies to promote awareness among healthcare providers and community members regarding the unique needs of vulnerable populations in the face of climate change, emphasizing the importance of inclusive and accessible care delivery models. The third is to identify advocacy skills to actively support policies and initiatives aimed at enhancing accessibility and inclusion in climate change adaptation and mitigation efforts, fostering climate resilience and equity within healthcare systems and broader communities. Next slide. So what do we mean? A bit of an overview about climate change. This slide is from the National Institutes of Health. They launched a climate change and health initiative in October of 2022. And they focus specifically on the fact that a changing climate impacts a range of factors that can affect health. And the National Institutes of Health across all of the institutes recognizes that more research is needed to understand the complex health outcomes, to address preventative measures and intervention actions that can save lives around the world. It's important to note that those who least contribute to climate change are disproportionately affected by the impacts. You can see on the left side that changes in climate include increased global temperatures leading to higher ambient heat, extreme weather and disasters, precipitation extremes, sea level rise, and changes in land use and growing seasons. Of note is that farmers in particular are impacted by climate change disproportionately. The effects of climate change are extreme heat, air and water pollution, reduced food and water quality. So there's a loss of protein, zinc, and iron in foods that are grown globally. Changes in infectious diseases and vector transmissions. For example, in the Northeast, Lyme disease is becoming increasingly prevalent related to climate change. And increasing allergens, more and more people becoming allergic to pollen in particular. The health impacts are heat-related illness, cardiovascular disease, stroke, and other chronic conditions, injuries and death, particularly from extreme weather, such as hurricanes, which have increasing velocity, zoonotic, vector, and waterborne diseases, respiratory diseases, and asthma. And then the interventions and strategies include early warning systems and preparedness, prevention or reduction of disease, illness, and injury. Community engagement is particularly important, and the National Institutes of Health focuses heavily on that. Education and awareness raising, adoption, and migration and integration of strategies for mitigation of climate change. The social behavior and environmental determinants include access to healthcare, diversity, equity, inclusion, and accessibility, which is particularly important for our discussion today, poverty and housing, immigration and migration. What's often not described is that the climate migration situation at our southern border of the United States is largely driven not only by socio-political unrest, but also by climate change. Environmental exposures, infrastructure, and then geography. With higher ambient heat, there are areas of the world globally that will be more and more difficult to live in. And what's often little known is that the conflict and subsequent war in Syria and the Middle Eastern migrant crisis is largely driven by a loss of arable land and loss of herds, thus leading people to move to the cities, and conflict and unrest and war breaking out. So examples of needed research include what are the new and emerging health risks from climate change? For example, one new and emerging risk is that pregnant individuals are at increased risk of preterm birth, low birth weight, and intrauterine growth restriction and cardiac anomalies of the fetus as a result of higher ambient heat and also the convergence of poor air quality. Other examples of needed research: who's most at risk, what health interventions are effective. So, for example, studies on cooling centers, particularly for the most vulnerable populations. Can we predict future health outcomes from climate? What health benefits or costs come with climate actions? How can disaster warning systems best save lives? How can healthcare systems prepare for challenges to providing adequate care? Sarah and I have several manuscripts on the roles of healthcare providers, And in particular, emergency departments need better preparation during periods of high ambient heat to evaluate patients, to assess them, evaluate, and have interventions. And how can communities best adapt to a changing climate? Next slide. So this is from the Lancet Planetary Health, and you can see that on the top axis, heat-related illness, evacuation, trauma, anxiety, and post-traumatic stress syndrome are particularly important after emergency situations. Asthma and chronic obstructive pulmonary disease, infections. So, for example, I mentioned Lyme disease, but also the outbreak of Zika was likely related to our changing climate, malnutrition, and conflict and migration. And you can see that health and health systems and social and structural determinants of health are all important factors in a climate changing world. And then ecological determinants of health include extreme weather, habitat and biodiversity, soil loss, water shortages, global temperature rising, and sea level rising, which is particularly important in the northeastern United States. Next slide. So climate change and the health of people with disabilities. The Environmental Protection Agency has a very important website on climate change and impacts on those with disability. What we know is that the term disability covers a wide range of conditions that may limit a person's ability to perform certain activities. And there are many types that include those that affect vision, hearing, speech, cognition, and mobility. In 2019, there were more than 41 million adults in the United States living with disabilities. And people with disabilities are more vulnerable to climate change because, first of all, decision makers, including policy and advocacy decision makers, may not fully consider people with disabilities in their planning. Secondly, that emergency warnings and other important messages may not be designed with accessibility in mind. I mentioned previously Hurricane Maria. Those who had disabilities were disproportionately impacted by negative health sequelae of Hurricane Maria in Puerto Rico. And in fact, people who were not disabled were able to relocate more frequently than those, for example, with renal disease who required dialysis, who subsequently did not have access to dialysis and had negative health sequelae. They may need ongoing medical care, which is certainly true, particularly after hurricane emergencies. Many of you may recall that the hurricane that struck Miami several years ago actually caused loss of power. And some areas, for example, long-term care facilities, did not have access to emergency power, and people succumbed to heat-related illnesses because of lack of access to air conditioning. And in fact, a nurse in an emergency department across from the long-term care facility where people were being brought into the emergency department, the nurse went across the street and realized that people were succumbing in the long-term care facility and really raised the alarm around them needing to be evacuated. And people with disabilities are more likely to have social and economic risk factors such as poverty and unemployment that put them at greater risk. Next slide. So Sarah will begin now with what do we mean by physical, cognitive, or psychological limitations. And it's important to note that mental health limitations also are precursors to negative outcomes after climate change. For example, people who are homeless, people who have mental illnesses and take certain Mental health medications may be at higher risk, as well as those with physical and cognitive limitations. Thank you, Sarah.
Wonderful. Thank you, Patrice. So hi, everybody. As Patrice mentioned, my name is Sarah McKinnon. I'm an occupational therapist, part of the system, the Mass General Brigham system, and director of a doctoral program at the MGH Institute of Health Professions. Now, some people on the call might be familiar with occupational therapy. Some might have never heard of the profession, and some might wonder what's the connection of OT and climate change. I'll get a little bit more into that, but just to give you a little overview, an occupational therapist or the occupational therapy profession is a healthcare profession. It's focused on helping people of all ages participate in the activities and the things that are important to them that we call occupations, despite any physical, mental, or social challenges that might face. So we work with individuals and their families to help improve their ability to perform tasks, live independently, enhance their independence and their quality of life. And we do that through a variety of different interventions. And I'll share with you some examples here, linking it to climate change as well. That being said, lots of people that I do work with, or that really, that is the target of our conversation today, are those that might have different challenges or limitations in their physical, cognitive, or psychological well-being. So I'd like to just provide some examples and some definitions of what I mean when I talk about some of these things. And so I think I start off with physical because that's often the things that we see the most or might be most readily understandable. And those are, when we talk about physical limitations, those are referred to as the impairments or restrictions of our bodily functions or movements. This could be for a variety of reasons, which is something that we're born with, also known as a congenital condition, or something that we acquire, such as injuries or diseases, or sometimes along the aging process. And so physical limitations can be categorized in a variety of categories, but some examples include your mobility or vision, hearing, or again, having chronic health conditions as well. You can imagine that just by sort of starting here, you can imagine those with a hearing impairment or visual impairment in addition would have different challenges or at least needs in how we access medical information and education for us to live independently as well. In terms of cognitive limitations, this refers to impairments in the mental processes. And so that includes our ability to perceive things that are happening and process them within our brains, also related to our memory and our learning, our reasoning, and problem solving. Oftentimes, when we talk about someone who has a cognitive condition or issue, it's most readily compared to related to memory or memory loss. However, there's so many other elements that we have to be able to do within our brains in order to process information and again, interact in our environment safely. And so examples may include those that have intellectual disabilities, again, some of which that are acquired at birth, some that are impacted by our environment, and also just other elements of learning challenges for those. A lot of these are often those unseen or not necessarily as frequently noted challenges that many of our populations that need to engage in their environment, their life, and the healthcare system are often having to navigate. And then just to define what I mean by psychological, Patrice did an awesome job of kind of intertwining mental health challenges. Our mental health diagnoses are actually threaded through all three of these. The prevalence of a mental health challenge is much higher for those with another compounding physical or cognitive or even a psychological limitation. So we talk about psychological, that is related to the mental health conditions or emotions, also behavioral functioning. And some of these, are things that, again, many of us are seeing much more frequently for a variety of reasons, but those include mood and anxiety disorders and also those some that are related to trauma. In fact, Patrice mentioned a bunch of natural disasters, and again, not necessarily saying that everyone, might have a psychological condition after experiencing trauma, but again, those who experience trauma such as major, not even just major life events, but also major weather events as well. Could also be, again, at heightened risk for psychological limitation affecting things that we need to address in climate change. So there are unique health challenges that are exacerbated by climate change. And Patrice did a lovely job with the visual to support from the National Institute of Health. Again, you'll have these slides after, and also some really nice resources that the National Institute of Health has supported related to this work. But I'd like to just further kind of identify, again, these 5 that are ones that we really consider across the health professions when we consider ways that we as a healthcare system, not just from the medical world, but also in rehabilitation and supporting the environment and participation, can think about when we're meeting the needs of our society related to climate change. And so that might not feel this way if you're in the Boston area right now. We're not experiencing a lot of heat, but there is a lot of individuals who experience heat-related illnesses might have difficulty regulating their body temperature. And this could be more susceptible to heat-related illnesses. And so I could insert a variety of conditions and diagnoses that this could be. However, for those who are unable to regulate their body temperature and are more susceptible to those heat-related illnesses, are certainly more at risk for things such as heat exhaustion, heat stroke, and ultimately greater needs for the healthcare system in an emergent way. Additionally, there's exacerbations of pre-existing conditions. We're seeing more and more people with pre-existing conditions, not just related to physical, psychological, and cognitive conditions, but just a variety of conditions that with additional stress from the environment become exacerbated. We see that not even just with the climate, but when we have stress in other areas of our environment as well, that we can have a heightened response, which can impact how we live, how we take care of ourselves, how we even access work and other things that are important to us. Additionally, things to consider for those with disabilities or, again, physical, cognitive, or psychological limitations is that they're also potentially at risk for increased risk of injuries. And so in climate change, one element of climate change or result is extreme weather events, and extreme weather events that are associated with climate change, such as Hurricane Maria and other hurricanes that Patrice noted, floods that we might actually even see here in the Charlestown area and Boston, and even wildfires that we're seeing much more frequently, particularly on the West Coast, can often pose heightened risk for injuries for individuals, contributing to physical limitations, and thus, again, trickling down to how one accesses their environment. If you have increased risks of injuries and experience these new physical limitations, that has impacts on all areas of your life, including how you take care of yourself in your home, but also how you access and take care of yourself for the things in your community. As noted, there's also mental health impacts as well. Finally, this all kind of culminates into the impact not only on one's day-to-day and quality of life, but the ability to access necessary care for optimal health care. And so when we have disruptions in the actual structure of our healthcare infrastructure related to the climate change disaster itself, it can absolutely impact how anybody can access care. So disproportionately can also limit those impacted by physical and cognitive and psychological limitations, who rely consistent, regular care and support services. So as you can see, gosh, I mean, I don't ever want to be a dreer here, but you can certainly see that climate change, as you know, but as now further supported, not only impacts our entire society, but really, really is heightened and can be even disproportionately impacted by those with additional physical, cognitive, and psychological limitations. So what can we do? What can we do as healthcare practitioners, as a healthcare system, but also what can we do being a provider or even a family member? I'd like to share with you some strategies that are currently explored and things that are currently being done, and also opportunities for us to collectively work together to help address optimal participation, safety, and health for individuals with disabilities related to climate change. So I think I'll make a plug here related to occupational therapy. I know that's not necessarily linked here on this slide, but I introduced myself as an occupational therapist, and you might, again, not necessarily know what an OT is, or if you do, I hope that we've helped you so much. But the role with OT and climate change is really awesome. As an occupational therapy practitioner, our profession has the ability to observe and modify the environment that we have control over, provide advocacy and education for our clients. Oh, 1 second. So sorry. 1 second. Here. Oh, no. Great. Apologies. Happy clicking. There's many things occupational therapy practitioners can do. Pardon my brief interruption here. So let's get into it, because these are not just focused on occupational therapy interventions and strategies, but they're really focused on what we as, again, providers, caregivers, even clients ourselves can do to help support initiatives for, again, optimizing and fully addressing the needs of people with disabilities related to climate change. So we've broken really these down into kind of three key ideas here. And number one is through education and training. So congratulations, you're contributing to that mission just by being part of our group today. There are initiatives happening all over the place, and probably could be happening even more, where we can address and educate the society of really not just what is climate change, but why and how is it important and what can we do. So we promote awareness by developing and implementing education and training. That's not just through forums like this, but it's also through how we prepare our healthcare practitioners. So Patrice, being part of the founding director of the Center for Climate Change here at the IHP, is really one mechanism for further infusing climate change education in the preparation of our healthcare practitioners, not just in the medical field, but also in the rehabilitation sciences, such as myself. So different things that we are doing and even could be doing more of is also educating the community about how to recognize signs of heat-related illness and how to teach that for other vulnerable populations. It's also important for us, depending on, again, where we live or what our environment and communities are most impacted by, to ensure that we are accounting for climate change when adapting and creating treatment plans related to medical and rehabilitation care. And of course, sometimes the things that we not necessarily see but know exist is that are related to mental health, and to proactively address mental health concerns or mental health opportunities that could be the result of climate change as well. Additional things that one can do, or that we are doing, is to help promote awareness in the actual community. And so there are opportunities for us to engage in different community organizations or groups or government agencies to help raise awareness to this. I know that there's a lot of work happening in the state of Massachusetts to help with being as proactive as we can related to the impacts of climate change on our infrastructure of our city and our state. But then there's also opportunities for us to ensure that we're infusing education and resources related to climate change of where our populations that are most vulnerable are attending and present. So that might include community forums or support groups. It also might include just think about where people socialize and gather information, infusing ourselves there, and not just only keeping climate change information at the healthcare level either. And again, we're always doing this, and Patrice is a warrior in this regard, and that is really collaborating with community leaders and stakeholders and policymakers as well, to ensure that we're being as proactive as we can rather than as reactive when it comes to the implications of climate change. I think that, finally, I think I'll note here other things, again, promoting awareness related with practitioners and families is really our partnerships and collaborations. And so one element that you even see today is ourselves as educators in the health professions collaborating with, yes, of course, the educational system, of MGB and at Mass General Hospital, but there's other opportunities for us to work together in development. And that really could also include a variety of things outside of the rehab professions, but also include, again, educating our colleagues and patients and families with other agencies, or again, linking climate change, not to necessarily be always always negative and reactive, but an opportunity for us to, again, proactively address the social determinants of care. Right. Patrice, do you have any great insight onto this? Because let me tell you, as having a parent of a 6-year-old child, I can promise you that that the climate certainly impacts attention and engagement in important roles.
Yes, this was featured on PBS NewsHour, and it's the Harvard study. They used PSAT scores, which are taken serially by children, and they were able to control for climate and air conditioning and socio-demographic factors. And they found that with high ambient heat, children learn significantly less in school. And if children are disabled, or if they have other have health conditions such as ADHD, their learning is impacted even more. So it's just one example of the hotter the planet grows, the less children are learning.
Awesome. Well, geez. Well, thanks for sharing this. Even though, again, I think about, I just think, sometimes so frequently, at least I think too in this forum, we think a lot about the health impacts related to climate change, but certainly the impact of climate change on our learning, our children's development, and thus everything after related to various elements of milestones and societal norms, trends, and roles that our children have. So thanks, Patrice. So I've shared with you a little bit about opportunities, again, some things that we might already be doing or opportunities that we can do collectively for system change. And again, you identified some of those things, but what are some of the, not necessarily the smaller things, but things that we can engage in right now as individuals or as family units, or again, maybe as part of your program or your department. And I'd like to link this for our final third of our presentation around advocacy and what we can be doing, and what are some examples of, again, what we can be immediately trying to do to help increase access to care, optimize health of our vulnerable populations, and again, infuse resiliency in populations who are so often at risk for decreased access or other challenges related to climate change. And so I kind of chose to separate these things out as how to advocate for enhancing accessibility, promoting inclusion of people with disabilities, and also fostering resilience, particularly in a time of hardship. All right, so first, enhancing accessibility. I have to tell you, and it will probably, if you talk to me, whether it's related to climate change or anything else, I will always tell you that policy drives how we access healthcare and education, and policy and legislation drives how we as practitioners are able to deliver care. So I always start off, even though it can be intimidating to a lot of people, that your involvement in the legislative process is absolutely foundational for sustainable change for how we access healthcare and how you are able, and the modalities in which you can deliver education and healthcare as well. And so what an example of what being involved in legislative advocacy might be is, first and foremost, knowing who represents you, voting, being registered to vote, and just having knowledge of resources of how to stay educated on different topics. And so I'll kind of pitch to you that if you like following federal legislation, congress.gov is my favorite website. I literally type in keywords and I star topics, and I get email digests about different topics. You could pop in the word climate change, and I did that, and I got over 100 results at the federal level of different bills that are currently, that have climate change somewhere infused in their work. Similarly, Massachusetts has a similar process as well, in terms of following and staying knowledgeable or getting knowledge. So that's kind of one element, is staying informed or getting informed. Another element of legislative advocacy is literally contacting those who make the decisions. And so that could look like having relationships with your state rep or senator, or also your the federal, people who represent you federally. This might just be sharing about your condition, or sharing about how potentially a heat-related illness or mental health or any challenges or complications that might be related to climate change has impacted you. If you don't necessarily have that story or that vignette, but know that you might be a part of a vulnerable population, it's important then for us to proactively share how climate change could potentially negatively impact participation. Additionally, being a part of awareness and educational campaigns. I mean, anytime that you learn something, I always say pass it on, and you're essentially creating your own educational campaign, right? So share a little bit about what you're learning here today and pass it on to your colleagues. But this on a larger scale might include, public campaigns or workshops, seminars, community events. I know, at least for example, what we're doing here at the IHP and the Center of Climate Change, we do host a variety of workshops and webinars, and sometimes we even have annual conferences to help really charge the community and creating our own educational campaigns related to this work and best practices for this area. The second area of three related to advocacy skills is promoting inclusion. And so again, this could be in collaboration and partnerships with where you work, where you frequent your time, sharing resources. And again, policy development. I started off with your engagement in state and federal policy, but there's also policies within people's workplaces, and also, again, where you work. So maybe even choosing to serve on committees, or help even create new opportunities within communities that you work or engage in could be great as well. And then finally, fostering resilience. Gosh, resilience is something that we talk about frequently in the educational space for, for students who might experience some challenges and very difficult situations. But it's also a really great word that I use for parenting, and that I use also a concept for, again, people who are susceptible to being really challenged in with really, either unforeseen circumstances, or again, having to really navigate something that they might not be expecting. So anything that we can do to foster resilience, increase self-empowerment, optimize and know and teach people how to advocate for themselves, say that they need something, want something, or at risk, is probably some of the best things that we can do, particularly as providers. And again, putting our, whether that's through role play, resources, mentorship, and teaching people how to assert their rights and navigate systems independently. So when we go back to our objectives for today, Patrice really launched us off with identifying specific health challenges, and myself with my lens as an occupational therapy practitioner, but also, a lot of the strategies that I provided are the very similar strategies that any rehab and medical provider would provide this population for exploring strategies to promote awareness and identify some advocacy skills, again, to help fully support and consider populations with disabilities related to climate change. So at this point, maybe I'll pass over to Amy for next steps for addressing some questions and moderate, but I do just want to take the time to thank you very much for inviting us into your learning space and allowing us to share our expertise and passion with you all. Thanks, Amy.
Thank you all. If you have any questions, feel free to enter them in the chat. We're now at the end of the session. We have a question regarding what we can do individually to support people with disabilities as it relates to climate change. For example, with the summer and warmer temperatures approaching.
Well, heat-related illness, of course, is the major concern in the summer months, and the fact that people with disabilities will be disproportionately impacted by high ambient heat. And making them aware of the signs and symptoms of heat-related illness, taking advantage of cooling centers if they don't have air conditioning at home, and avoiding exposures. Sarah?
Yes, absolutely. And that's to help support our answer. Thank you so much, Patrice. I will just throw up one more visual that Patrice noted, because I feel like this answer could be so appropriate for summertime, but also for wintertime as well. And so again, if, thank you. Whoop. Well, I wanted to, we'll see. So sorry. Okay, maybe I won't be, sorry. Okay. Well, maybe I'm not as fluid there, but again, to echo Patrice, early warning and preparedness, even just paying attention to the temperature and knowing what it's going to be the next day before you engage in the community. Again, being education, a use of any education and that is provided from the community. And also particularly related to heat, being sure that you're using the cooling centers if that is something that you don't have access to in your own space.
And where can one go to learn where the cooling centers are located?
The Journal of Climate Change and Health is a completely open access journal, and they had a program specifically about cooling centers in Boston and the amount of coverage. I'm going to see if I can quickly put that in the chat. I'll look for that right now. But and Dr. McGowan had a question about their programs that, such as Mass Health or Mass Save, to help bring things like trees or reduce cost air conditioning units. It's a terrific question. Dr. Eugenia Self, who's in Philadelphia, she's an emergency department physician, has actually done research on green space and the importance of green space and tree cover in the Philadelphia area. We now in Massachusetts, the governor appointed a climate czar, and we also have a climate person for the city of Boston who was appointed by the mayor. The Barr Foundation has done a lot of great work. One of their arms is on climate change. But to the question that Dr. McGowan wrote, air conditioning costs are a huge burden for people. And increasingly, there's concern about the electric grid being able to be fully available for people, particularly during periods of high ambient heat. You may also have seen in the news that in Cuba, there was a huge protest because of blackouts, and they'll be heading into hotter weather as well. So it is a major problem. I've also seen literature that even for people who do have air conditioners, that the exorbitant cost of electricity leaves them not using air conditioning to cool as much as they already would have. I know here in the city of Boston, electric costs went up significantly over the past couple of months. And the city does have an early alert system around high ambient heat, in particular, telephoning residences, but of course that may not access everybody because some people have only mobile phones, and whether or not they're accessed about extreme heat and other weather circumstances is a question.
Mm-hmm.
Do you have anything to include, Sarah?
No, that's very comprehensive. I mean, I just know that any kind of resources related to the state and and the city sometimes can be challenging to find, but I do know, at least I feel that when safety is part of the implications of something, that hopefully a little bit more readily accessible. So the city of Boston information, Massachusetts, and also social media would be great resources.
I also will share that I sat on a panel on Saturday at the Museum of Science And the Museum of Science is now focusing for the next year specifically on climate change. They have exhibits and programs, and that's a great way for families to get in, to learn more about climate change and health, and to educate the next generation. We ended the panel talking about hope in a climate changing world, which is particularly important because there's lots of important work going on, so that eco-anxiety and the new concept of solastalgia, which is worry about the future of our environment and our planet. And so Sarah and I bring hope to the landscape as well of climate change.
Thank you. And you had just shared a resource from the city of Boston on keeping cool in the heat, and I had just shared that in the chat with you all.
Thank you.
We have a question regarding online resources. Where can one go to learn more about climate change and its impact on people with disabilities?
The EPA website, I will also put that in the, but they have a very good website about disabilities and climate change, the Environmental Protection Agency. As a matter of fact, Gina McCarthy, who was formerly the climate czar in the president's White House, and previously during the Obama years, she was head of the EPA focusing on climate change. She is really a remarkable person. And then the other place is the Aspen Institute. They just had a conference in Miami, and I spoke on a panel with Dr. Victor Zhao, who's the president of the National Academy of Medicine, of the National Academies of Science, Medicine, and Engineering. And the Aspen Institute, I'll put that in the website as well. And they have great climate resources.
Thank you. And while Patrice enters that in the chat, feel free to enter any questions you have.
I'm just going to paste that to everyone also.
Thank you.
Sure.
Right, so I don't see any additional questions in the chat. I think it's okay to end a few minutes early, but before we do you have any final thoughts you'd like to share with the audience?
Be hopeful about our climate change efforts.
Thank you so much for having us.
Thank you. And for those who took the time to join us today, thank you so much for joining. Hopefully you found it helpful. As I had mentioned, today's session is being recorded. It'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Thank you so much, everyone.
Thank you.
Have a lovely rest of the day.